Restoring multiple anterior teeth in the dental office using Cerec CAD/CAM 3D design technology. The teeth are scanned prior to any preparation, then prepared for ceramic crowns using local anesthesia. These crowns were completed in segments, first the right side, then the left, but could be finished together in one longer visit. This patient elected to keep her single front crown, and the new crowns were designed around it. The original tooth contours can be replicated, but in this case the position and shape were improved upon using the design software. Our Primemill milling unit shapes the crowns from individual ceramic blocks within minutes. The team polishes and adds glaze for a shiny and smooth finish and places them in our firing and glazing oven to complete the fabrication process. The crowns are seated in the mouth and the smile and oral health are restored.